Congenital heart block is a rare condition that is identified as interference with the transfer of electrical nerve impulses that regulate the normal pumping action of the heart muscle. If the electrical nerve impulses are transmitted normally, then the heart behaves normally. This condition affects 1 to 5% of babies that are born to women who have antibodies to fight an infection in the uterus or in response to an autoimmune disorder. This condition can be detected at or before birth and is commonly diagnosed between 18 to 24 weeks of gestation. This rare condition affects around 500 babies in the US every year. CHG has 3 degrees of impairment: first, second, and third. The first degree is when the 2 upper chambers of the heart, or known as the atria, beat normally. However, the lower 2 chambers beat slowly. It is considered first degree if the time taken for the impulse to move from the atria to the ventricles is longer than 0.2 seconds. Patients who suffer from the first degree will fatigue quickly and have difficulty breathing. The second degree of congenital heart block is characterized by dropped or skipped heartbeats due to some signals that don't reach the ventricles from the atria. There are 2 subgroups. One is Mobitz type 1, which is a progressive delay between heartbeats until a beat is dropped or skipped. It will cause short-term dizziness and modest fatigue, but it's not considered dangerous. Mobitz type 2 is rarely encountered but carries a greater risk. Patients will suffer an extremely low heartbeat, and it's because the majority of electrical impulses can't reach the ventricles. Patients will fatigue quickly, experience difficulty breathing, and unconsciousness. The third degree is considered complete heart block. Electrical signals don't reach the lower chamber of the heart at all. The atria and ventricles beat independently, which will cause patients to lose consciousness, breathlessness, lack of energy, low blood pressure, chest pains, and dizziness. Causes. In the majority of cases of CHB, the cause is actually unknown. However, in some cases, antibodies from the mother cross over to the fetus via the placenta, which fights an infection in the uterus or is in response to an autoimmune disorder. Treatment. In patients who suffer mild forms of CHB, treatment is not required. Physicians may recommend temporary or permanent pacemakers depending on certain cases. Some cases of first degree, a drug, atropine, is used to temporarily increase the AV conduction in the heart. The article that I've used in relation to CHB is called "The First Fully Implantable Micro Pacemaker Designed for Fetal Use." The Children's Hospital of Los Angeles and the University of Southern California have created the first implantable fetal pacemaker for patients with CHG. Previously, the pacemakers used were for adults but would be implanted into the fetuses. The electrical lead would be implanted in the fetus, whilst the rest, the generator unit, was implanted into the mother. This method failed because due to the fetus moving, the electrodes would become dislodged or disconnected from the heart or would become infected. The new pacemaker, once implanted, will do no harm to both the fetus and mother due to being implanted in utero. The pacemaker is a sterile, simple, and inexpensive device that is essential to aid and prevent this condition from affecting fetuses. The device itself consists of a slim cylinder designed to fit through a 3.8 mm diameter insertion cannula. A cannula is a hollow implantation tool used in fetal surgeries. It has a wireless recharging system with a small lithium battery, and within the pacemaker, which powers the device for a week. Once that week is over, or when the power runs out, a high-powered field generator is used to generate a radio frequency magnetic field outside the body, which wirelessly recharges the battery through inductive coupling.